Hi, it's Dr. Malik here from the Muscle and Joint Clinic. Today I want to talk to you about 6 chiropractic myths that I encounter as a chiropractor. I thought you might find these interesting, and we'll go over some of these. And if you have any questions, you can mention them in the comments. So chiropractic has been around since the 19th century. It involves basically the use of hands to help correct muscle and joint issues. So if you have a tight muscle or a tight joint, chiropractors can help stretch those muscles, can help realign joints, can help improve flexibility and improve mobility. There's a few myths that I'd like to start off with. The first one is chiropractors only manipulate spines. So it's pretty incredible that a lot of people still believe that chiropractors only treat the spine. We actually treat all different types of joints in the body. We treat hands, elbows, knees, basically any joint that we have access to. One of the more unusual ones that we treat is the TMJ, which is your jaw joint. So if you have pain around your jaw, it could be because of TMJ pain. Another joint that we treat, which is quite odd, is actually the little ossicles in your ear. So there's these 3 little ossicles that sometimes there's pressure that builds up in your ear, and chiropractors do an ear tug to help release that pressure. It's really one of the strangest ones, but it has helped a few of my patients, and it's something that we keep handy for when we need it. The second myth is spinal manipulation hurts. So I actually yesterday had a friend come in who's a geriatrician, and he finally decided to try chiropractic care, and he was quite hesitant at first, and but we got through it, and he actually felt incredible. So his hesitation at the beginning was he thought it was going to hurt and it was going to cause pain, but actually it didn't. Once we got past the noise factor, and he realized it actually was quite relieving. So if you ever have had like your fingers or your hands tense up, you might have noticed that after cracking your knuckles, you might feel a lot of pressure relieved. So that's really the same thing we're doing as chiropractors. We're just helping these joints move and get that flexibility back as well. So spinal manipulation doesn't hurt. Now, I should mention that if you have a really bad episode of back pain and your muscles are really, really tight, if we do a chiropractic adjustment, well, first off, your chiropractor has to be very careful, because if they're not, you can cause that muscle spasm to get worse. So you got to be gentle. You got to take your time. The other thing is you have to take a lot of patience. Sometimes you may have a patient, and before you adjust their neck or their back, you have to get them to relax. And if you try to rush things, you could cause the problem to get a lot worse. So if the chiropractor is taking their time and taking precautions, spinal manipulation should not hurt, generally speaking. The third myth is chiropractors only treat neck and back pain. This kind of goes back with the first point, but we not only treat neck and back pain, but we can treat elbow pain, we can treat pain around the knee. Hip pain is another really common area of concern. We also treat numbness and tingling. So sometimes you can get nerves that are compressed due to tight muscles, especially like in the front of the neck, around the shoulder, around the glutes, where it can cause sciatic-like symptoms. So we don't only treat neck and back pain, but we actually treat nerve issues as well too. And the other myth is, I think this is number 4. Once you go to a chiropractor, you'll be going forever, and that is not necessarily true. A lot of this depends on your goals. If you have a sprained ankle and you're seeing a chiropractor, once the sprained ankle is better, you don't need to see a chiropractor after that, as long as you do your rehab and you keep yourself healthy. However, if you're sitting at a desk all day hunched over, that pain is probably going to come back. And if it does come back, you're probably going to need to see your chiropractor or your massage therapist or your physio again. So this myth about going back to a chiropractor forever is can be applied basically to every profession, and it all depends upon your environment and what you're doing day to day. Now, if you take care of your body, if you're running, if you're strength training, if you're stretching regularly, then you probably won't need to see a chiropractor as often. But if you're sitting on a sofa and you're sitting in your car and you're sitting at the office and all day you're just sitting hunched over, yeah, that back's probably going to hurt again, and you're probably going to need to see your chiropractor more often than you probably first anticipated. So, we always promote at our clinic, we want our patients to help themselves. We really believe that your body is like a machine. You got to take care of it. What you do day in and day out really affects the way you move. If you're sitting and you're not taking care of yourself, you are probably going to develop some back pain. And it's easier for us to also treat people that are taking care of themselves in between appointments than seeing somebody who is not taking care of themselves, because usually they need more care, and they need more encouragement to take care of themselves. So we highly recommend our patients to do what they can to keep active. Even if it's sorry, I'm going on a bit of a rant, but this is very important. Even if you're going on a walk, 5 minutes, 10 minutes, do it. It's going to help mobilize your spine. It'll keep your upper back moving. It'll keep your legs moving. You'll get better circulation through your body. It'll help with your mental stress. And I'm sure with COVID going on, everyone can use a little bit of alleviation with their mental stress. So do take care of yourself and do try to keep active. And the last myth here, I think this is number 5, is you need a referral from your family doctor. And we don't need any referrals. This is usually just depending on your insurance company. But for a chiropractic perspective, you don't need a referral. You shouldn't need one from your doctor. But for other services like physio and massage, you may require one. So just call your insurance company and just double check with that. So I hope you found these myth busting tips helpful. And if you do have any questions about chiropractic care, or if you're interested, or if you have any ailments, or if you have pain, or if you just want to move better, or if you're just more interested in taking care of your body, just give us a call. Our number is 905-593-1605. Take care, be safe, stay healthy.